Well, hey, everybody. Welcome back to HWL Talks, where we get to sit down with leaders and innovators from all across healthcare. And my name is Trevor Strauss, Senior Vice President here at HWL. And today I'm extremely fortunate to be joined by somebody that I've had the pleasure to get to know over the last few years, Valerie Myers. She's a Senior Physician Recruiter currently with Humana. And we've spent a lot of time talking. And so I'm excited to have her here today because she's helped me learn a lot over the last number of years in different areas around everything from how physician recruiting is changing, the roles of the recruiters, how to engage leadership, but even more using analytics, using data, using things like ChatGPT, et cetera, to really kind of change the game in recruiting. And so I don't want to steal any of her thunder. So I'm going to let Valerie introduce herself here today, and then we're going to dive into some questions. So Valerie, thank you so much for joining us. And could you tell our listeners a little about yourself before we dive in?
Yeah. Again, thanks so much for having me. Really excited to be here. Like you mentioned, so my current role is Senior Physician Recruiter with Humana's primary care organization. We have about 350 primary care clinics, all in the geriatrics and value-based care space. And the markets I cover are all in Florida, which is about half of our clinics, which probably isn't surprising to anybody when you're talking geriatrics, that about half of our offices are in Florida. But I've been there about 2 years. To go back, how did I end up being a recruiter, which is one of my favorite questions to ask people generally. How did they get into this? Because it's not a major. It's not something that anybody, says as an elementary school kid, like what I want to be when I'm older as a recruiter. So how do you get there? And I'm probably one of the few people who it's a family thing. My mom was a recruiter. So my mom was a recruiter in Chicago and mostly in the tech field. And so in college, my part-time job was sourcing for my mom. She would put me on monster.com and tell me, find people like this. So like very early internet that screeched at you, that kind of a thing. And then after college, I kind of took a sidestep into teaching. And then when my husband and I got married and moved to Bloomington, Indiana, which is where IU is, my first job there was in an agency role. So got to work with a lot of, smaller clinics, rural clinics, but, really the full breadth of lots of different types of roles and things like that. And that was great. And then took a little step away from it when my kids were young, just needed a little bit of time and flexibility with them. And then through, a colleague, I think a lot of people find the right opportunity through somebody they know, right? Found out about this role at Humana on the in-house side. And again, at the time, wasn't really looking for something, but when I read it, it was like, this is the perfect opportunity. So have gotten, it's a great organization, definitely meets, my value system, but it's also led to a lot of cool opportunities for continuing education, which is how I got into kind of the AI and tech space, which is what I've been talking about at a lot of physician recruiting conferences. And that's how we connected. So, yeah.
No, I think it's great. As I mentioned for our audience, these presentations that I've seen from Valerie over the last couple of years have really been eye-opening for, myself and for other colleagues, just in how kind of the role of physician recruiting is changing. And so Valerie, obviously you had some really humble beginnings in kind of being the sourcer for your mother, which I didn't realize till right now. So that's kind of cool. But, I've been in this world, about 18 years now. And so kind of seen some of the evolution of what it means to be a, quote unquote physician recruiter. But I think it's changed, right? And obviously I'm on a different side of the aisle, so to speak, of the relationship that I have with hospitals and health systems. But why don't you talk and tell us a little bit about some of the things you've shared with me over time about how recruiting's changed and also how it hasn't, right? There's still fundamentals that are the same, but the role itself, I think, is becoming more nuanced and frankly, more sophisticated at this point. So why don't you share a little bit of your thoughts around that?
Yeah, definitely. So I think what I've seen, and I don't think this is exclusive to the in-house side. I think it's that everyone any recruiter agency side in-house is seeing is that there's been a big shift, I think, in terms of how we look at the value of recruiting from filling roles, filling jobs to being a true strategic workforce advisor, right? There's a lot of increased complexity, I think, in terms of candidate needs and preferences. I'm not saying anything anybody doesn't know in terms of it's getting harder and harder year over year and possibly exponentially in terms of finding particularly physician and provider candidates. But I think that the biggest difference that I'm seeing is the expanded skill set. It is not just a relationship building, recruiting role, guiding people through the process. I think it's becoming more and more critical to understand employer branding, to be able to interpret and storytell around data, to utilize tech and to know how to do that, but with these fundamentals that make recruiting a very human job, right? Like the tech is not going to replace us, but the person who knows how to use tech, how to recruit in the current age that we're at with the internet, with AI, that's the person, right, who's going to be really stepping into these roles. And I think that's what's necessary right now.
What about the balance of kind of that internal client versus the external client, the candidate, right? So obviously there's more and more people that have either a line of sight into it or are paying more attention. There's different C-suite leaders, there's different other executives, service line leaders, et cetera, that are weighing in, because we both know that back in the day it was, we need a geriatrician and I expect you to fill that thing in 30 days or whatever. So right. What are you seeing, before we even get into kind of how you're using data and analytics and AI and all of that to aid in this, which is extremely important for recruiters to understand, what are you seeing from those, maybe we just call them political dynamics, right? It's the things that you have to balance both internally and externally to keep the candidate happy, but also engage all the proper stakeholders so that everybody understands what's going on internally.
Yeah. And I totally know what you mean. And there's really two different stories you're telling, right? So there's on the physician side, or, the person that you're recruiting in, there's something missing for them to even answer that, message from you, whether they're actively looking or they're passive and just get a message from you. There's something fundamental that they're missing or hoping for that is causing them to be talking to you. So for them, it's really honing in on what are those pain points, what are their goals, what are the things that they're looking for, and talking about your organization's value in terms of them meeting those things. Even if pay is the same or, things like that, what's different? What's the reason that they should be looking at your organization as an employer? But, in terms of internally, that's a whole, I think, kind of other thing. And I think it's really about being able to speak the language of leadership, really being able to express where recruiting sits in terms of organizational impact, because ultimately the number one resource in any organization, any company is the people, right? But we need to be speaking to the things that these leaders are going to be dealing with when they get off the call or in that next conversation around cost savings, patient care outcomes, reputation enhancement, retention, and we need to really position ourselves and the work we're doing within the framework of how these leaders are looking at the role and really kind of show off our expertise or kind of figure out how to talk about that, because we really do have a lot of, like you said, a lot of data, a lot of information. So how do we get that through? How do we make those meetings really impactful? I think we can definitely dive further into that.
Yeah, well, I think it leads us a little bit to some of the things you have been presenting to different sessions at AAPPR, the regional shows, et cetera. And that's how you use data and analytics. I think that one of the things that I've really learned from you and getting to know you is, we'll talk a little more about the seat at the table, kind of really the leadership stuff in a minute, but you've laid such a great foundation, and it might just be something you've always done more, just because you knew to do it, right? When it came to the data side, but the things that you've shared at these conferences around how to use data, how to use AI, how to use things like ChatGPT to tell that story, to really differentiate, because you can't sell either internally or externally to the candidates or your leadership what's going on and what the value prop of recruiting is without data. So why don't we kind of dive in a little bit there? Because that's really an area that I know when I've been at these shows over the last many, many years is resonating extremely well, because every physician recruiter out there, whether they're just starting or they've been doing this for 15 or 20 years, is still struggling with telling their story the right way, getting perfect data, and also balancing 800,000 things that you all have to do every day. I think sometimes people think it's more about the dinners and the tours and all of that, and they think it's fun, which that is true. It's enjoyable. It's great when you have the candidates there, but they don't understand the amount of painstaking work that has to go in to get that person there. So share a little bit more around some of those key areas that you've been talking about for the last few years for the APPR members in particular.
Yeah, and you're right. That is the fun stuff. The fun stuff is getting them in town and, having the basket at the hotel and the dinners and, finally getting to show off the organization, the brand new building that you have for cardiology, whatever it is. That's the fun part. And that is the tip of the iceberg, and 90% of the work is really underwater where nobody is seeing it. But, I think the thing that I've, kind of been talking to people a lot is that to get to those people, to get them to that point, our window is getting smaller and smaller. There's all these places, all these resources, online. But the gatekeepers are email subject lines, texting, these really quick messages. And when you go to conferences, when you speak to physicians, they say, I want, the salary and the bonus and the information right in the subject line, or I'm not even going to open it. Right. So like our ability to even get to those people, we can't really pick up the phone anymore because nobody's going to pick up the phone. Even if you do, they're not going to pick it up. They're going to screen it, so it's so hard to get to people, which is why we need to have a data-centric approach. But most importantly, that kind of translating that data into action, right? So if you're sending out emails through a system, right, and you can see the open rate, and then you can see the apply and response rate, right? So it's great to have that data, but what does it mean? What it means is what you're putting in that email subject line resonating with people where they do click it, right? On their phone, in between patients, they click it and scan it, right? And then that's step one. And then step two is the message inside of it leading to people responding to you, right? And if they're not, then we have to figure out what's holding them up, So, I think that from that perspective, we need to use data to tell a story to other people, but we also need to use it for ourselves in terms of what kind of action we're taking, what kind of messages we're putting out there. And who has time for that? Nobody, right? I mean, it's hard, right? It's hard to step aside and say, I'm just going to sit down and do a big review of this. But I do think, for me at least, and that's what I kind of talk about at the conferences, is that's where AI fits in. So things like generative AI or technology like that, I apply that to pain points in my day, not the stuff that's going well and going easy, but the stuff that's stopping me up. Because any point in my day that I can automate, any point in my day that I can make easier and save even 10 or 20 minutes, that's a phone call I can make to a CMO to talk about strategy around something. That's a time where I can do these kind of human aspects of the job, which are the biggest value. So I guess for me, that's where technology fits in, is not to take over the things I'm good at. Although, like I can write a Boolean string. I don't do that anymore. I let AI do that for me, right? Because I just can't do it as efficiently, even though I'm good at it. But, that's where I'm using it, is to, kind of come up with more examples to get those messages written, things like that.
What about from I think one of the things that I've heard people still struggle with is really trying to cut through the noise, no matter what level or what seniority or age, Gen Z, Gen X, Gen Y, millennials, like, doesn't matter. Are you seeing anything within the candidates that you can use AI, you can use generative AI, or you can use other, tools and analytics to help catch their attention? Are there any key differences that maybe somebody who's listening to us today that hasn't seen you at one of the shows and is a recruiter and is frankly struggling to cut through the noise? We see the reports, we see how long it takes to fill these jobs. Have you been able to use technology to help you speed that side of the process up, meaning really get in front of that candidate, get them to respond so you can kind of get them into your pipeline and start having that discussion?
Mm-hmm. Yeah. So the way that I use, and I'm going to talk about generative AI here just, for this question, but I am not using it to make myself faster or my messages faster. I'm using it to make them better. Right. Okay. So I could come up with a really basic prompt for, write me an email for a primary care physician for Orlando, Florida. And what I'm going to get is a perfect template message that anyone and everyone else is sending. Right. And so what I want to use the AI for is to go further and personalize that. Right. So again, if I know that, if I'm thinking about that for physicians, a big issue is, let's say call schedules in there, I want to put into the AI, here's my standard message I'm sending. Help me rewrite this in a way that really emphasizes that our physicians have phone only call and they really only have to be on call 2 or 3 times a year. Right. Or I take that basic message and I say, write this in a, new year, new opportunities type of theme, right? And so what I want to do is stand out, but sitting there trying to come up with the perfect words for something, those are the places that I use AI, right? Or like, this is the email subject line that's working for me. Give me 5 more like this. And am I going to necessarily use exactly what it gave me? No, but I know, the kind of tweaks that I want to make to it. And the hard work of going from 0 to something, that's what I'm letting the AI do. And then I'm, kind of using those from there. So I think the big thing for me is using it to differentiate, because if what I'm going to get is just a really standard, basic thing, then I already have that. I already have all those sitting in a quick parts or whatever, those kind of basic responses. But, to your point about different generations or things like that, another thing I think about with using AI for editing or creating things is that I really can't perceive myself, right? So I know that I'm a millennial, I'm Midwestern, there's, all these things about me, and I'm coming from my own context, right? But let's say I'm writing a message to, a bunch of primary care residents who are probably, more towards the Gen Z or younger side of millennial, right? At the most. So can I put into Chat GPT or something like that a way to change the tone of that message, or to think about the things that are going to appeal to them? If I'm, going to a conference for a specialty that I would say much more formal, right? Or who are of a different generation, then maybe I want something that better suits that. If I'm writing a response to somebody who isn't a native English speaker about a contracting question, is the language I'm using going to confuse them more because it's not language that, would be intuitive for them? And can I filter my response through AI to make sure that I'm communicating really effectively and clearly? So, it's really kind of thinking out of the box to try to create something different than just something fast.
Well, I think that's great because, even like, as you just said, you were talking about using it for maybe like a non-English native speaker for contracting. Like, I was thinking more about this all front end, right? How do we get people excited? How do we get them to click? How do we get them to respond? Versus you got to still use these tools to augment the processes and the human element all throughout the recruiting process, right? And probably even retention. There's probably things that you guys do on that side too that we won't necessarily have time to get into today. But I think that that leads me to one thing that I would like us to touch on before we run out of time today. And you have done so much with different data tools, knowing your numbers, having analytics to be able to figure out how long it's taking you to fill, benchmarking that against the industry, et cetera. And I know from working with you and getting to know you, how that's helped you aid in those leadership discussions. And this is an area that too many times, the quote unquote recruiting team is not really thought of as that strategic partner or, that higher level partner to even HR. And sometimes it's just being told, go get a doctor for us. No details, nothing to help them stand out, like you said. So you've leveraged these things to really help yourself better communicate with your leadership team. I think that if you can share some of those best practices that, are the things that you can talk about, right, externally, that it would be really, really helpful for listeners that could still be struggling with that within their organization. How do you message it? What do you report back on? Because sometimes, and I think you've said this to me before, it's not even all that fancy. It's just some basic stuff that you have to be able to track. So why don't you share, as we wrap up today, some of those thoughts with our listeners that hopefully they can take back and then maybe create an actionable plan for themselves?
Yeah, well, to your point, it shouldn't be fancy, right? It should be very clear, and should come across very quickly and very, easily. So you don't need any $10 words or, things like that to try to, make yourself look like an expert. You are the expert. But, the first thing I would suggest is to make your time count. If you have regular meetings set up with hiring leaders, hiring partners, your meeting needs to be about strategy. If it should not just be reporting about recs on a spreadsheet, right? That could be an email. We need to go further from that, right? And really talk about that recruitment strategy. And then get yourself into, if possible, if your meetings sound like that, they're going to lead to the leader thinking, I have another meeting coming up talking about retention. You should be there. And when you can continue to position yourself as an expert, as a resource, as a partner, then when you're in that meeting, now you can advocate for resources. You can align yourself and the hiring goals with the needs of the institution, and you can influence people better, the more of those discussions that you're in. I would also say something that I've been working on, particularly the past year, is typically our focus is on the open jobs, right? And that is stressful because especially if there is a position that is empty, it's not like we're replacing somebody who's retiring in December and we're talking about that now in January. Wouldn't that be great?
That'd be amazing.
Right? That would be, I would love that. But most of the time there's a hole and it's stressful for everybody. And of course that's what people want to focus on. We also need to focus on what went right. So when we were in this situation in the past, what worked, or what are the different strings we can pull if, this needs to happen right now, or as soon as possible, then what can we do? And so I feel like we need to present also not just problems, but solutions. The way you get, especially into those higher level rooms, is to be the solution person, right? So to be reframing every problem as, well, here are the action items we can take. Here are the solutions that I can bring from experience, or here's what works, or here's who I'm going to connect you with. And when it's like, Valerie always has ideas for solutions, that really is just going to kind of increase the relationship, even though we know we're all talking about the same problems. And that doesn't mean to have some like golden view of everything. We need to recognize how hard this is for everybody. And especially my team is remote, right? So I'm not even in the clinic every day, right? And so I think that that's something that the market leaders want us to know. Like, it's hard in there right now. We're having a hard time. It's hard on everybody. And we know that, but it's really to kind of make sure that you're ending the meetings with solutions, with action items, that you're following up appropriately, things like that. But I think, again, you also really need to showcase your success, right? And so for me, the way I do that is data plus storytelling, because people love statistics and things like that, and they also love stories and wins. So I would say something like, we decreased our hiring time from 97 days on average to 90 days on average for a primary care physician in Florida. And I think you can look at the Tampa market as as a perfect example of what that's done. That when we're getting people in sooner, our physicians are less stressed. Our leaders have time to be thinking forward about talking to residents, talking to fellows that, we might want to bring on, and we can be more proactive and less reactive. And, 7 days might not sound like a lot, but it makes a big difference. Every single one of those days make a difference, right? So making sure that people see the story, the impact of anything that you're sharing. Hopefully that makes sense.
No, I think it makes a ton of sense. And you're right, 7 days can mean the world. And, if you're not willing to tell your story and champion yourself and your teams, who's going to do it? And it's not self-promotion when there's facts behind it. So I think that that's really key for the leaders, for, our listeners to hear, is that the way to get the leader's ear is to give them the facts, give them the tactics that got you there. But like you said, the idea of being Mr. or Miss Fix-It at times too can really get you far. And it can get you invited into rooms that maybe you're not supposed to be in yet necessarily, or, you never thought you'd be in, but it can be very exciting when you do that. So again, Valerie, thank you so much for being here with us today. It's been a pleasure getting to know you. We're going to obviously continue getting to talk and, discuss these topics. And, we may even have some future discussions with a bigger group around like AI and things, but I think this has been great. I think this really can resonate with a lot of different people at different levels within the organization. And my other hope is that, if there are some leaders that haven't been as engaged with their recruiting teams, they see how important and how vital the work of the physician recruitment and any recruitment teams and TA teams are within their organizations. Because like you said, labor is 60 to 80+% of the cost of organizations. And so you guys play a vital role. So thank you for all you do. And thank you to everybody for joining us today.
Thanks so much for having me.
All right, everybody. Well, I hope you enjoyed today's discussion with Valerie, and please certainly subscribe to the podcast to continue following and talking with leaders and innovators all across healthcare from around the country. And we hope to see you soon.